What is the most common misconception that you've come across to the cancer patient?
The patient was asking, sir, if my grandson stays with me, will the cancer spread? When we touch someone, only love spread.
How is your life as a medical oncologist?
The first thing which anyone thinks as cancer is depression, but it is not so. You should see a cancer ward of children. They'll be running around, not really worried about what's happening. Some of the cancers are curable at whatever stage it is. For example, Yuvraj Singh.
We've heard that in US there's a medicine which has come up for cancer.
America has a very good clinical trial background. Their trials are much better than us.
Why isn't it brought to India? What's the worldwide lobby behind it? Welcoming you all to the poster show. Today we have Dr. Guruprasad, who is an oncologist, and let's understand the untold stories of cancer. Cancer, a disease that affects millions across the globe, and let's figure out what is cancer, the cancer cure, and the cutting edge technologies which can make the cancer treatment better. Let's not wait further and let's dig in into the topic that matters to all of us. Welcoming Dr. Guruprasad Bhat.
Thank you, madam.
It's indeed a pleasure to have you, sir. Thank you so much for coming on our stage and giving awareness for the cancer patients and also to the youngsters how they can learn more about the cancer. So, sir, how is your life as a medical oncologist?
Life as a medical oncologist, the first thing which anyone thinks as cancer is depression, but it is not so. They would have seen all the movies and stuff and realized that that's the only part. We have the happy part too, where children who develop cancer, you should see a cancer ward of children. They'll be running around, not really worried about what's happening. They'll take their injections and they'll be running around and things like that. The happy part, 90% of cancers in children are curable. The other way around in adults, it's the other way around where someone will be lying down, family members will be standing next to each other. Majority of the cancers in adults, they present in advanced stage, may not be curable. So that is how it is. We see both the happy part and the sad part. But yeah, some of the cancers are curable at whatever stage it is. For example, Yuvraj Singh, if you have heard, any stage of cancer of germ cell tumor is curable.
Right. And what are the different types and organs which get affected by cancer? So basically, is there a different cancer which is for the men and for women?
If you say cancer, the first word which comes to our mind, the first thing that comes to our mind is smoking, but it is not so. Cancer, the most common affected, if you take both male and female combined together, it is females. So the breast cancer is the most common cancer. So that never comes up in the list. When anyone says cancer, you would have seen all the movies, and before the movies, the Raju coughing and things like that. But that's not so. Most common cancer is breast cancer, and it's always underreported. They would come probably 3 years, 5 years down the line because they would have thought, let my child grow up, let him have his school gone up, or finish his college and let him finish and things like that. It's a painless swelling, so they would neglect it for a long time. The awareness is not there. The other most common cancer in India is cervical cancer. That's the second most common cancer. It's and still not much awareness is there. It's preventable, like how you took a vaccine for corona. Similarly, you have a vaccine for this cancer also, and it's a preventable cancer. Not many know about the vaccine. It's hardly 1,500 rupees per shot, and not many know about it. So, more awareness, and this cancer can be preventable. It's a virus-associated cancer. And the next other cancers are usually head and neck cancers in males. It can be smoking related. So tobacco, it's Indian oral cancer. This is not seen in the rest of the world. They chew tobacco. India, we chew tobacco, arecanut, betel nut, any of those forms. And rest of the world, they don't do it. For them, smoking comes up. Whereas Indians, we have oral head and neck cancers where we swallow and chew tobacco. So these are the common cancers which we see. The breast, the cervical cancer, and head and neck cancer, they account to almost 60% of all cancers that we know of.
Right. So there is a term called as know your body. That's the zero stage of cancer when it's initially developing. Could you please enlighten us about that?
Okay, stage 0 in cancer, there are 4 stages: stage 1, 2, 3, 4. And stage 0 is when it is not yet crossed the basement membrane. So each cell grows to a particular size, and then there are blood vessels for it. It breaches the blood vessels, capillaries, and goes to the rest of the body. That is how we say. So if it is not yet crossed the basement membrane from the tissue where it's arising from. It is not yet crossed. That is where we call it as a precancerous stage. There are multiple precancerous stage which we can detect. For example, in oral cancer, the precancerous stage looks like um, you take boil milk, and that malai, what we say, if you see like something like that on the oral part of your mouth mucosa, then that is a leukoplakia. It's a early stage cancer. If you treat it at that stage, you can be definitely cured of the cancer. So each cancer has its own precancerous stage. For example, cancer of the food pipe, esophageal cancer, what we call Barrett's esophagus, may be one of the early precancerous stage. So each cancer has its own stages, precancerous stage. Only thing, it needs to be picked up. For example, you tell a cervical cancer or the cancer of the mouth of the cervix or the uterus, that part. Um, from the early stage to the actually when it is detected, it takes at least around 5 to 10 years. So these stages are pretty early to present, and not many, they're usually painless. That is where the problem arises. And you will think, we may probably show a doctor a painful ulcer in the mouth, but the painless ulcer is like, leave it, I'm not going to show. That is where the problem arises. If you know the symptoms of cancer, I would definitely say that a precancerous lesion, anything abnormal from your normal stuff, please show your doctor, is what we would say.
So, what is the life cycle of a cancer cell? So, from the beginning stage, so there are four stages. So, how does a tumor grow from one step to the other stage?
For a cancer to be detected, it needs to be at least 1 centimeter in size, and 1 centimeter in size, what we see is not one cell. So a cell has to acquire those mutations. So like we are all programmed for some, we are programmed to be born at some time, just have youth, then adulthood, and then we die. Each cell in our body has its own lifespan. For example, a RBC, blood cell, has around 120 days of lifespan. After that, it's gonna die. Similarly, each cell in our body has its own pre-written lifespan. Then it dies of apoptosis. If it breaches any of this lifespan, multiplies on its own, then spreads to other organs. That is where the problem arises. Uncontrolled division leads to cancer. So the first problem is how to detect them. So 1 centimeter cell is equal to 10 to the power 9. That's almost a crore, 10,000 crore cells. So it's a big number of cells. So for us to see, hi-fi scans like a PET scan or MRI or things like that may detect around 10 to the power 7 cells or 10 to the power 8 cells. We don't detect one abnormal cell in the body. So we don't have technology right now to detect that one abnormal cell. Our PCRs are trained to probably 10 lakh to 20 lakh cells. So we have limitations in detecting as of now. One abnormal cell in the body is very difficult for us to pick up. But yeah, a small size we can definitely pick up. For example, a blood cell, abnormal one blood cell, probably by PCRs we can detect it to some extent. Now what happens is this abnormal cells goes on developing on its own, increasing in size, attracts its own blood vessels, grows to a bigger size in a solid tumor. Whereas in a hematological malignancy, it keeps on proliferating to a size where normal production of other cells becomes difficult. Once it spreads to other cells, other parts of the body, that is when we call it a stage 4. But before that, there are other stages. From the for a solid tumor, from the site where it is produced to the nearby draining area, produce some we call some lymph nodes or lymphatics or blood vessels. From where it spreads to that to the nearby area, we call it stage 2 or stage 3. For example, if I say a breast cancer, early stage may be less than 2 centimeter size tumor, slightly locally advanced maybe 2 to 5 centimeter or with the lymph node spread, and advanced or metastatic disease is when it spreads beyond the organ of presentation.
So, what is basically a lymph node for a general public?
For a general public, okay, there are two types. If I explain, there are two types of road: a national highway and a state highway. So cancer will always want a national highway, the bigger roads for it to spread to rest of the body. So the lymphatics are basically the national highway where bigger things, bigger trucks, bigger ships can pass through. Whereas the smaller state highways are capillaries where smaller cells pass through. So the cancer usually spreads to the lymphatics first, most of them, but some of them spread through the blood vessels also, sarcomas and all. But yeah, most of the cancers, carcinomas, what we know, spread via the highways and they spread to the other parts of the body. These are ways which helps the cancer to spread to the rest of the body.
Right. So, taking an example of a breast cancer, stage one, it's the size of a raisin.
Yeah, less than 2
Yeah.
centimeters.
And how much time does it take to reach stage two?
Okay, that depends on the type of cancer, that is the biology of the disease. So, breast cancer, as we know, all cancers are not the same. You may have heard of someone with breast cancer surviving for 20 years, some of them surviving for 3, 4 years. Depends on the subtype of cancer or the molecular type, what we say. So, for example, ER/PR positive, the hormone positive types, HER2 negative types, they usually do well. So, we take the doubling time. So, from one cell to divide into two. The doubling time may be more than 6 months for a hormone positive tumor. Whereas the HER2 positive or the triple negative, they are the other subtypes what we have. They have a very fast doubling time. Their doubling time may be less than 60 days. So depends on the molecular type. So like all five fingers are not same, all breast cancer may not be the same. We need to know which subtype of it. Similarly for lung cancer also, whether it's EGFR, IL cross, we need to know the subtype of it to know how fast it will spread or the overall prognosis, how long and how short the time is.
So, what is the most common misconception that you've come across to the cancer patients?
The most common misconception is today morning also a patient was asking, sir, if my grandson stays with me, will the cancer spread like that? No, what when we touch someone, only love spreads. We can spread love or affection and things like that. Cancer will not spread that way. And sharing their clothes is not gonna spread cancer. You definitely should be with them. That's what even in any stage you should be with them, the family members. And other misconception which commonly say is if you do biopsy, cancer spreads. Biopsy is for diagnosis. We need a tissue diagnosis to know a cancer. Just by looking at it, we may not be able to tell that this is cancerous or not. The other misconception which we have is every cancer is hereditary. If my parents have, I definitely want to have. No, 5% of cancers are hereditary. 95% is your lifestyle. So how it is and how you lead a lifestyle is all that matters for cancer. Only 5% are hereditary. Vamsha Paramparya Bharva cancers are very less. So that is the other misconception what we say. And there are a lot of misconceptions. For example, an elderly man has difficulty in passing stool. The first thing they think is piles. Piku movie, Amitabh Bachchan had difficulty in passing stools. The first thing they come to across, oh, piles. It may not be. If piles doesn't subside, please show a doctor. These common symptoms are problematic. Amitabh Bachchan also says that if more than 2 weeks cough is there, think of tuberculosis. As an oncologist, we say if TB is not detected, think of cancer also. At least get an oncologist checked. So there are common misconceptions because we highlight on something which is more common. TB is more common, piles is more common, but yeah, cancer is always there. If it is not subsiding, symptoms are not improving, I would always suggest take another opinion from an oncologist or ask your doctor, can this be anything else? Because it's not improving for me. Over 2 weeks, 3 weeks, I've taken whatever medicine you have told.
So, basically, if we take five examples for any cancers, what are their early symptoms? So,
Okay,
if you name the cancer,
okay.
example breast cancer, what is their early symptom?
For breast cancer, the symptoms are a painless lump in the breast, which may not move. So normally, a lump in the breast is mobile. 90% of breast lumps are not cancer. They are hormone imbalance and things, and we have something called fibroadenoma. So they move like a mouse. If you this is a skin and this is a tumor below, it moves. So these are called breast mouse. Whereas a cancer is fixed. So if you have a painless lump which is not moving around, or you have a swelling in an armpit with the breast lump, you have an armpit swelling, then that is where we are worried about. Or the skin over the lump looks like an orange skin. We call it pudgy orange. So if that is seen, that is also we are worried about. Or the nipple goes inward, inversion of nipple, or um, we have blood discharge. These are some of the symptoms for breast cancer. For oral cancer, I've already told something which looks like a malai on your mouth, white or a red patch when scratched produces a bleeding. Then we're worried that it may be an oral cancer. For lung cancer, cough, vomit, cough, blood and sputum and things like that, weight loss. If it is there more than 2 weeks, we are worried about esophageal cancer, difficulty in swallowing, change in bowel and bladder habits for any of the GI cancers. And a woman who was menstruating, her menses stops 50, 60 years at the age of 60, again she develops bleeding. This is where a postmenopausal lady develops bleeding, then we are worried. It can be a cervical cancer or a endometrial cancer. Cervical cancer is a mouth of the uterus, and the endometrial cancer is a uterine cancer. These are some of the cancers which have some symptoms. In the West, there are also there are other common cancers like the skin cancer. We have this blessing of a better melanin there, so we are not supposed to get skin cancer. But yeah, if a mole which increases in size, these are some of the symptoms of cancer.
And what about the most rare? That's the bone marrow cancer.
Depends on cancer is a great masquerade, so you don't have anything very particular. For example, even a breast or most cancers are painless. So bone cancers can be most common bone cancers are spread, meaning they are metastasis. If you have a lung cancer, that has spread to the bone, or prostate cancer spreading to the bone. So these are common cancers which spread to the bone. But the rarer cancers inside the bone, what I'm saying is the surface. What is inside is the bone marrow. Their bone marrow cancer can have weakness, easy fatigability, and most of them ignore it as a symptom of an elderly person, gentleman and a woman, and they say, okay, vayasagide, and that is the way they ignore it. And when the blood shows low counts and things like that, that is where we think this is something abnormal. So they have very rare symptoms. They have common symptoms of elderly age, but they are rarely picked up. They are very rare cancers, probably 1% of cancers of all bone marrow. But yeah, they also have their symptoms, which we ignore as symptom of elderly.
So, any young person getting a bone marrow cancer, is that count
Okay,
into the practice?
younger children have more aggressive cancer. They usually don't have they don't have a slow growing cancer. They're usually fast growing cancer. Their growth is like that. So usually the common cancers in children are acute leukemia, the blood cancer, or bone cancers can be osteosarcomas. These are the bone. These are not just in human beings. The tall breed of dogs also develop. So at the rapid growth, around 16 to 18, that is when they develop these cancer. You can have the cancers of the soft muscles, soft tissues, what we call soft tissue sarcomas are common there. You can have brain tumors also common in children, medulloblastoma. So children cancers in children are different from cancers in adult, and most of the cancers in children are curable. 90% of cancers in children are curable up to the age of 18. They have a good bone marrow reserve, so whatever treatment we give, they respond beautifully. So in children, we definitely say pick them early and don't mess them up. And with all forms of treatment which you come across in Google, definitely ask a qualified person. And if something is not what the child is usually doing, not feeding right, not playing what he likes to play, consult your doctor.
So, what's the difference between the slow growing and the fast growing cancer cells that you mentioned just now?
Okay. In adults, we have not all tumors, not all abnormal swellings may be cancer. Some of them are benign. So, how do I okay, a tumor can grow in size but doesn't spread anywhere, so you just remove it and it is done. For example, people have swelling here or anywhere in the body, small swelling people may have in the skin also. These are abnormal accumulation of fat, lipomas, what we call, and these occur at any age, any this, and they don't increase in size and they don't spread anywhere. They're so abnormal accumulation of fat tissue, lipomas. So these are benign. Basically, they don't spread anywhere and they don't metastasize, what we call in technical words. Whereas a cancer has the ability of spreading. So even if you remove it early stage, it can still spread to other areas after 5-6 years. So benign tumor, what layman says, not in our medical terms, but what a layman calls it is a male type of cancer. It doesn't spread anywhere, and malignant ones they call it the other way around, which spreads everywhere. It produces small metastasis, small. They say "Marit to ಬೇರೆ ಕಡೆ ಹರಡ್ತದೆ." That is how they say it, but that is not how we technically tell it. Benign tumors doesn't spread. Once you remove, you don't need any form of treatment, radiation, surgeries, chemotherapy. Nothing is needed, or you can just wait and watch. That is also sufficient.
So, that's the basic difference between a cancerous cell and a
And a
non-cancerous
non-cancer
tumor.
tumor,
Okay.
teratoma, thymoma, I mean those tumors which doesn't spread anywhere else.
So, what are the most common non-cancerous tumors that you've come across?
This is commonly seen in family members of someone who is suffering from cancer. Swelling anywhere it arises and they feel it is cancer. So common ones are some swelling in the neck or swelling in the arms, and they feel the most common is swelling in the breast itself, where it's a fibroadenoma, where we don't do anything. It's just a hormone imbalance and things like that, where there is a pain associated. Some of them have generalized adipose tissue collecting, lipoma, leiomyoma. These are some of the tumors. Uterus will have leiomyoma, which is also called fibroid. These are common tumors, and they don't spread anyway. Wait for your hormones to regularize on its own. These tumors, breast and the uterine ones, will subside on its own, and you lose some weight, or the lipomas is there throughout your life till you're there of 80, 70. It will be there with you. It's not going to harm you.
And can the lymphoma ever turn to a cancerous cell?
Rare, they don't.
Okay.
Most of the time, they don't.
Okay, so most of the time, all the
Benign tumors,
non-cancerous
yeah, benign tumors may
tumors.
not spread, but some of them do.
Okay.
But to be on the safer side, a benign tumor rarely spreads, because sometimes people will wrongly take it as a this, that all benign tumors needs to be operated. No, just keep a watch. There's nothing. It's not increasing in size. It's been the same size for years together since your childhood. Don't do anything for it.
So, what is the connection between hormones and cancerous cells?
Commonly, the two common hormones, estrogen, progesterone in females, and in males the testosterone. These are the two or three hormones dependent cancer, where we manipulate the hormones. So in you have increased obesity because of increased adipose tissue. Adipose tissue is a fat cells in the body. More fat tissues are there. Postmenopausal obesity, the higher risk of increased estrogen production, and these adipose tissues are converted into hormones. These hormones stimulate the breast to proliferate. So that is how we obesity can lead to cancer. Obesity can also lead to the other hormones which I said is testosterone, and may not be related, but yeah, we can use it for treatment of blocking the hormonal pathway. We can use it for treatment. Obesity per se, if I take obesity per se, there are 3 or 4 common cancers which are related to hormones and obesity. One is uterine cancer, Garbhakoshada cancer, breast cancer. Uh, Other one is Pitta kosha, the gallbladder cancer, what we call, and the esophageal, lower end of esophageal, foot pipe cancer. These are some of the cancers, colon cancer. These are some of the cancers which are related to obesity, probably a hormone imbalance, and related to developing cancer because of some hormone imbalance.
Some superfoods that can help us prevent cancer, or in general, which is good for the body.
Okay. What is good for the body is you will know, and not by the taste of it. What your mother or grandmother would have told, this is good, this is not good. That is your body is used to that food that is good for you, and they will know by experience, years of experience. I know taste is one thing which matters for us, but that's not how we go by what is good and what is not good. So anything in excess, atiyada amrita visham bante. So anything in excess is bad. So if you are just drinking Pepsi, Coke all the day, it's gonna be bad for you either ways. Even so what I would like to suggest is, whatever is the lifestyle your parents have taught you, just follow it up. Doesn't mean that I take burgers now and eat pizza in the evening. It is not a part of your lifestyle. Your body is not used to it. uh, Whatever superfood is good, your parents would have told, this is what it is, this is, your body is used to this lifestyle. And definitely keep your weight in check. So how do you tell that? Is your height in centimeter, whatever is your height in centimeter, minus 100 is, that is how much your weight should be, plus or minus 10 kg. So if the height is around 170, minus 10, minus 100, that's around 70. You can have your weight between 80 to 60. That's an ideal range. What we, just for example sake, is what I'm trying to say. So there's no superfood to prevent, and the superfood is ask your mom. She will know what is good for you.
So, what role does food and nutrition play after the cancer surgery, or maybe during the treatment of chemotherapy? What food should a patient intake?
Uh, there are 3 aspects on oncology. One is medical oncology that we come across as chemotherapy. There's a radiation oncology, which commonly people call it as current and something like that, where they say it's burning. The other part is surgical oncology. So each of them have their own role of food. For example, a head and neck cancer patient will have difficulty in swallowing, irrespective of solid foods may be difficult. A patient on radiation may have difficulty in swallowing anything which is spicy. Pickles and all may be difficult. So each cancer per se will have their own particular food which a doctor will say. So head and neck cancer patient will usually want to take anything liquid diets, ganji and things like that, honey and things like that. Some patients may have a pipe in the abdomen, so we need to give more liquid stuff. But generally what we say is home cooked food, cook it and then take it. That is what we usually say. And the other way is the Western style of giving roses and all. The immunity may be low. You may actually spread fungal infection. So there are things which we say don't do it. Just because you're seen in the movie, don't do it. We avoid flowers in the ward, oncology ward at least. So there lies the thing. Construction site nearby, we are worried. Usually we try avoiding overcrowded places. So if there's a family function where there are good food, yeah, we'd say keep them out for some time at least till their immunity is back to normal if they are on systemic treatment. For radiation, usually it's the spiciness of the food and the liquidness of the food, whereas surgery depends on the type of surgery which was done. For a breast cancer patient, not much of a difference in diet. They'll have to control their weight per se. Otherwise, not much change in the diet. Some cancers may need a change in diet altogether. For example, if you have a colon cancer, meaning the lower end of this one, they may have a bag and they have difficulty in taking some food stuff. Something like potato may produce a lot of sound, which is irritating when they have a bag for the urine, a bag for a motion. So there are some things which we specifically tell for a particular patient. Not we can't generalize telling for this all cancers avoid this and something like that.
Yeah, right. So, what's the major three differences in the cancer treatments that you mentioned, the medical oncology and the surgical one? Is it always that first the tumor is removed and then the medical oncology is pursued, or is it the other way around?
Depends on the patient and what stage it is presenting, and depends on the cancer also. Some cancers will need surgery irrespective of what stage it is. Some cancers will need injection irrespective of what stage it is. So for example, Yuvraj Singh didn't have a surgery at all. He just they did the they gave him the injection, they did a biopsy, gave him the injection, and he's cured of the cancer. For some cancers, surgery is a must. We can't avoid cancer surgery for some. For example, colon cancer, we can't avoid surgeries. Breast cancer in early stages, we can't avoid surgeries. So um, all the different departments are interconnected to each other. We can't say that we do this first, we do this. It's a teamwork. All of them have to play their role, and only then we can get a better outcome for a patient with cancer.
Right. So in this case, every person depends on which cancer and what
What stage
stage
it is?
it is in. Only then the treatment is decided.
Yes.
Okay, so there's no general treatment for any cancer and such, like a breast cancer or anything, lung cancer. So everything based on the symptoms.
Based on the symptoms, the stage it is, what's the subtype it is. Some cancers may need first surgery. Some cancers may need first treatment, yeah, systemic treatment downstage and then decide. So depends on the cancer, depends on what stage the patient is presenting and things.
So the most difficult stage or the patient that you've ever dealt in your life.
Okay, the difficult parts are when the cancer comes back. You would have cured the cancer, and then it comes back after 3 years, 4 years, 5 years. They would have got all the hopes back, and then uh, it goes down. They would have felt once it comes back onto stage 4, their hopes are up, and you know this may not be curable, and some things like that. How do you convince the patient? How do you convince a family member? Because they all ask us, doctor, allow me to survive for this many years. These are the things I have in mind. So convincing them that we are not God, and that is where our limitations are. We can do what is available for science with as of now in 2024. We can't change the course of disease altogether. We may change for some early stages, some good biology disease, but not all. We may not be able to totally cure them. So sometimes it's very difficult to explain a mother that her child may not survive and taking them home, or someone who is in ICU for a long time telling that we may not be able to cure him completely. Difficult is when the cancer comes back and we are not able to give them that hope which we were able to give 5 years before or 10 years before, when it was an early stage and we would have probably controlled it for that long.
And why does it come back?
uh, Disease biology, as we say, some cancers never come back, some cancers do, and no one knows why which mutation has taken over. I know it's very easy to say that molecular things have changed a lot. cancer doesn't read textbook, so they don't follow textbook guidelines or internet. So they have their own mind of their own. Some cancers do come back, some cancers don't come back. If they don't come back, we are happy. If they do come back, it's a difficult scenario both for the patient and the doctors.
So, which are the ones that do come back and which are the ones that actually don't come back?
Okay, some of the cancers have a very high cure rate. Germ cell tumors, um, some tumors like leukemia in childhood, they have very high cure rates. 95% of cancers are curable in that. So they need some other factors also we take into consideration before you just go into telling that. But yeah, some of those 5 to 10% of cancers are early stage cancers. They are very highly curable. For example, a breast cancer in early stage, less than 2 centimeter, the 5-year survival is almost 99%. That means they will survive for a really good time. The problem is in India is the present rate. 87 point, almost 88% of them present in advanced stage. They would have taken all other treatments possible, googled it, asked their friend. Then if you're building a house, you'll ask the civil engineer. But if you're taking a treatment for yourself, you wouldn't ask the doctor per se. You'll ask all other things other than the doctor. So anyone in your family who's a doctor, please ask them. They'll be able to guide you better. Or a doctor nearby is also good enough.
So, which doctor should they approach when they see a tumor? Because they generally, that awareness is not there in India, and usually there's a habit in India that you just go to the pharmacy and then you say, okay, I see something and can you just fix this up?
The first thing about seeing the online Google thing is even a benign sneezing, they would have put up a brain tumor as a first differential diagnosis. You get worried and then come to the doctor. But yeah, if you ask the pharmacist, he'll give a simple medicine. But I would suggest there are a lot of family doctors or a doctor nearby whom you're confident with. It doesn't need to be a simple, any doctor whom you're confident with or your parents are confident with. Please go along there and they will be able to pick up cancer at any stage.
And how does it spread from one organ to another? And
Uh,
is it that all the cancers do spread from one organ to another, or again that's divided?
Depends on the cancer. Some of them spreads to the national highway, as I already told, lymphatics. Some of them spread to the state highway. Some of them don't spread. The benign tumor may never spread. It may be there for 20, 30 years and doesn't spread. Some of the blood cancers, they always spread from one organ to another. There's nothing called spread for that. There's no hard and fast rule for them. So depends on the cancer to cancer. Some of them do spread. A benign tumor may never spread lifelong.
So, which are the cancers that do spread?
Malignant tumors, what we call cancerous,
Mm-hmm.
do spread everywhere over time eventually. So if it is detected now, probably for example, if you say a breast cancer detected now while having bath, a lady will detect some smelling there. Usual history is 5 years down the line she comes with breathlessness or back pain. That is how they present, and they'll say, "Maga, I was waiting. It was asymptomatic. My son was abroad. I was waiting for him to come down. Then he got busy with his work stuff, so I forgot about it. Now I have a back pain. Kindly relieve me of the back pain." This is there from years together. It is not producing any problem. That is how we commonly see. This is the most common cancer, breast and cervical cancer, all the same way. And it takes roughly around 15 years for them to diagnose that cancer. And a cervical cancer, by the time in India when we were studying 10 years ago, we would just detect them by they coming into the clinic or OPD. The smell of urine mixing with blood and motion, that's a bad smell. Women will know the smell of blood, menstrual blood. That mixing with urine and motion, such a bad smell that the lady walks in, we know this lady has a cervical cancer. So we don't need hi-fi tests. That is the stage they present with. But we don't want that stages to be presenting to us in the hospital. We want more awareness. So for a breast cancer, we would need a mammogram or an X-ray, what we call. And for a cervical cancer, we would need something called a breast test or a pap smear. And these are simple tests. If you do once in 5 years or 10 years, we are more than sufficient to tell, okay, another 5 years down the line. But the problem which comes there is the social um, factors associated. No lady will want to get a breast examined by anyone, and no lady will be ready to get a cervix examined. There are a lot of social issues associated with it. Once that awareness is built that this is not for the society, it is for you, you are taking care of yourself, that is where we may probably break the barrier and get more early stages to be detected.
So, is there any test currently which can detect cancer? Like some, like how we have vaccines for, polio and other things. Do we have any vaccine per se or any test?
The three most common cancers don't need hi-fi tests. The three most common cancers: oral cavity, you just have to open your mouth, see in the mirror, and you know it. Either you have difficulty in opening your mouth, or you have white patch or a red patch in your mouth, and that is where we can pick those cancers pretty easily. Breast cancer, I've already told the symptoms: a lump, painless lump, and no change during each menstrual cycle, or a old lady having a breast lump. You need to show a doctor. And the postmenopausal bleeding is where we think of cervical cancer or a uterine cancer. These are common cancers. 60% of them we can detect by just simple uh, awareness, telling them what it is. A simple test, mammogram. You don't need any hi-fi tests like PET scans or MRIs. A simple test, a pap smear. Pap smear is basically a brush test. Like how you brush, it's a brush test there, and we can detect a cervical cancer. These are simple tests. You don't need to think that I'm in a small village, no test may be available. I have to wait for my son to come back, or the doctor nearby may not be so advanced. It's not so. A simple doctor can detect a cancer in every stage.
Right. And how often should these tests be conducted
At
and what age?
anyone more than 40 years, we would suggest them to get the testing done for cancer. And probably every 5 years, guidelines wise, every 3 years or every alternate years, but it's difficult to follow guidelines in Indian scenario. Getting a blood test is only a difficult thing. At least once in 5 years or 10 years, if you get it done, we are more than happy. And if symptomatic, please come. If you have a lump and you say I'm waiting for next 5 years, not so. If you have a lump in between, please come and show a doctor. Sometimes they do develop that fast that we would definitely need a doctor to pick it up. You spoke of vaccine in between. We have a vaccine for cervical cancer, and definitely it is well appreciated if a lady in the age of 9 to 20 takes this vaccine, and they're hardly 1,500 rupees. We have vaccine for other cancers like hepatitis B vaccine, hepatitis, which prevents hepatocellular carcinoma. There are some cancers which can be prevented by vaccine, not all, which are virus associated cancer, and definitely um, worth taking them.
So, who are the general public can approach to take vaccine? Is it that if parents have cancer, the kid should actually start taking the vaccine, or is it in general everybody should actually start creating awareness on this vaccine as well as start taking it?
Okay, the parents having cancer, the kids having cancer is only 5%. So get out of the misconception that if the parent has cancer, no. The child has a bad habit, child has a bad lifestyle of food, then he may develop. Second question asked is whom to take. The most common vaccine which we definitely tell is to tell a human papillomavirus vaccine, and Indian government is producing it. And the Poonawalla, who is pretty famous with the corona vaccine, he's only producing it. So if you have not developed side effect with the corona vaccine, you can definitely take this vaccine too. And the age is 9 to 26 before your first sexual encounter. The younger the better. It has its own moral implication. That is why we don't highlight it so much, because we need to take them explain what is this vaccine, what is this virus, how does it spread, and things like that. So we tell the younger age, 9 to 20, or younger age 10 to 20, the first and second decade. That is where we definitely tell take this vaccine. And it's definitely worth for the female to take it. Now, males usually we do advise, but yeah, most of the time it's for females.
So, anybody who's in the age of 30 to 40.
They would have test like the pap test and the mammogram, which is available for them, 30 to 40. If there is a hereditary breast cancer, there are some cancers which can be hereditary. We do specialized tests rather than the simple screening. For a breast, we have something called MRI of the breast, and those specialized screening are needed for specific hereditary cancers. If someone in your family has colon cancer, we would suggest do colonoscopy every 5 years, or the youngest age in some of your family members. For example, I have seen a family of 16 who developed colon cancer. Everyone, 16 members having colon cancer. The youngest developed at the age of 20. So the 18th year birthday was celebrated with the colonoscope. So that is how we see. If someone in a family has cancer at a younger age, your family history says so, and you have tested genetically, you have proven, we would suggest some specific tests for them. That doesn't mean that everyone needs to be tested for cancer. Lead a normal lifestyle, that's sufficient.
Right.
Healthy lifestyle.
So, your tips for a healthy lifestyle per se. Especially what you do, because your lifestyle has 16 to 18 hours of work sometimes, and you're continuously seeing medical patients with suffering at different stages from chemotherapy to other things. So,
Uh, what we'll get later in life is unpredictable. Whether you will develop cancer, will not develop cancer is unpredictable. What is in your hand is taking probably a healthy diet, a good 8 hours of sleep, good family food, avoid food which your family cooks, avoiding junk, and reducing the screen time, reducing plastics in some forms at least. I know we can't avoid plastics in all things. Yeah, these are some of the healthy things which everyone would know as a moral science. In sixth standard they were taught you this. Just follow that. I know it's very difficult for a youth to follow. No, the taste bud says something else, the iPhone says something else, the screen time says something else. Just follow a normal 8 8 8, and 8 hours of sleep, 8 hours of work, and 8 hours of 2 hours of family time, 2 hours of personal time, and things like that. The other two. So we have something, a well balanced life is definitely worth better than something else.
so could you explain us about chemotherapy and the other advanced treatments like immunotherapy and the targeted therapy?
What we saw in the 1960s, 1970s were these older treatments, surgery, radiation, and chemotherapy. But what we see now is more advanced. Immunotherapy is your own body's immunity is picking up cancer cells and killing them. For example, I say it's like a policeman. We are giving our body's immune cells, policemen's guns, and telling them hit them. Your lathis are not sufficient. We are giving you guns and bomb, but hit the cancerous cells, hit the wolf which is hiding in the sheep's clothing. That is what I'm just trying to say immunotherapy is. So this will pick up and this will definitely kill. The other ones are targeted therapies. For example, you would have seen Arjuna and the eye of the sparrow. That is what targeted therapy is. It avoids all other proliferating cells, just the eye of the cancer cell. So a targeted therapy works on a particular target. For example, a lung cancer has a particular target, a particular mutation. You give a particular drug, geftinib, erlotinib, osimertinib. A blood cancer CML has a particular target mutation, and we give imatinib for them, and they survive for 20 years, 30 years without, just like how hypertension patients or diabetes patients take a tablet, these cancer patients take a tablet for the rest of their life. So targeted therapy are for a particular targeted mutation. Immunotherapy is to activate the immune cells and kill the cancer cells.
What are the pros and cons which are seen after each therapy is given?
Okay, chemotherapy may work on all rapidly growing cells, so you'll have hair loss, may be there, may not be there. Some recent advances may not be there, and surgery may have its own pros and cons during the surgery and after surgeries also. But yeah, surgery is needed sometimes. Most of the time, patients are worried, but it's needed sometimes. Radiation has its own advantages and disadvantages. Radiation is almost like a cold knife. What a surgeon does, this fellow does with lights and radiation. Immunotherapy is like I've already told, a policeman giving bullets and guns. He can hit the robbers, but sometimes he may hit the normal bystander simply walking around. Autoimmune disorders may be there. Targeted therapy may miss the target, so you may hit the eye of the sparrow like the Arjuna, or he may miss slightly that's the side, and there some may develop some other unrelated side effects. So they may have their own side effects, but yeah, what the effect they produce is much more than the side effect they produce, which may be minimal and it can be well controllable. For example, if I tell chemotherapy, the first thing they say is uh, hair loss. It is temporary. The hair will come back after the end of chemotherapy. At the end of 6 months to 1 year, they will definitely get their normal hair back, and we don't have to worry much about it. But yeah, for a female, removing the breast, removing the hair is a totally different thinking perspective, because for us it's pretty easy to say the womanness comes from the way they look, the hair, and things like that. I know it's very easy for us oncologists to say, but for a patient may be difficult. We have a lot of advances there too. Wigs are there, or some chemotherapy may not produce hair loss itself, some tablets may not produce hair loss itself, so there are advances there. But yeah, over time we may see better and better things, and without vaguely disfiguring the patient, we may be able to give a good quality of life too.
And why is the hair loss prominent in chemotherapy?
Because it works on any rapidly growing cells. So there are 3 or 4 rapidly growing cells. A cancer cell is one of them. The nails may change in color, become dark. Hair also grows probably 1.5 centimeter per week. So there, three phases in hair growth, so they may go. Some of them don't work on the hair cells altogether, and some chemotherapy, some immunotherapy, some targeted therapy. Most of the targeted therapy and immunotherapy will not have hair loss, and some of the chemotherapy will not have hair loss. So ask a doctor if you're really concerned of hair loss, or what we are looking at. We are looking at cure, we are looking at control, we are looking at palliation, what stage of cancer, whether this treatment is going to cure your disease, whether this treatment is going to improve your lifestyle. All those things you can ask your doctor. There are multiple treatment options, and the doctor is better judged to decide what is good for you and what stage the cancer is in.
So we've heard that in US there's a medicine which has come up for cancer. Why isn't it brought to India, or per se why isn't it commercialized? What's the worldwide lobby behind it?
Okay. And this is the, what you say, the dark side of oncology. The drugs in India. India is known as the drug capital, where we produce a lot of drugs on a generic scale. So generic scale, um, it's like the difference between a Maruti and an Audi. They work, they do maybe the same, but they have their own advantage and their own class of people. A drug in patent may be a worthwhile drug, uh, because the cost may be very high. But yeah, the advantages, a lot of people would have, they would have spent a lot for the research of the for that drug. It's not that all drugs are successful. One out of the 1,000 drugs are successful. So you can imagine how many trials they would have gone through, how much funding they would have gone through. We don't have such good clinical trials in India. There lies a problem. So America has a very good clinical trial background. So their trials are much better than us, and we don't. They don't just copy paste like what we do in the internet and give that this is the result of it. So I'm not saying we are bad. I'm saying that we have a lot of patients, but not many doctors have the time to conduct clinical trial. A doctor in America may probably see 6 head and neck cancer in 1 week. A doctor in India may see 100 head and neck cancer in 1 day. We don't have the time to do so much of clinical trials. So the trials there takes a longer time, more research and more orienting to that particular drug, and that is how it comes to the market. Big number of money would be spent, so it takes at least 10 to 15 years for the patent to go. So till then the drugs will be really expensive. Once it is in out of patent, India produces generic drugs, and that is where most of our patients will be able to benefit. So if you tell me a drug costs around 2 lakhs per month, and you have to take it for 2 years, it costs around 74 lakhs. I'll be also thinking whether it is definitely worth it. But the same drug goes out of patent, may cost around 5,000 or 2,000. Anyone, a common man, will be able to afford. But yeah, that doesn't mean that all drugs are good, all generic drugs are good. Sometimes we may have heard of chalk powders being put. So it is not all white and black. Not the American drugs are good and not the Indian drugs are bad. It's a shade of gray. So Indian drugs have their own advantages. The American drugs also have their own advantages. We need to take a pinch of salt, taking both of them, telling this is better or that is better.
And in the world of AI and robotics, how do you think that it's going to help us in the medical field, especially in the cancer department?
AI is in surgery. There's something called robotics, and what the general conception is, robot means the robot does the operation and the doctor sits away drinking a sip of coffee. That's not so. Robotics at present are useful in areas where the field is very small. For example, pelvis, this area, this field is so small, all major nerves going to the legs are there, and you don't want to injure them. Meaning our tools are pretty big, our hands are pretty big, may be difficult to go there. That is where robotics come into the picture. So, robotic genitourinary tract robotics makes a huge difference. Some area like the esophagus, the food pipe, which is very close to the heart and things, those areas they make a huge difference for robotics in surgery. Now AI is in oncology. AI is basically you type what cancer you have on the internet, you'll get one AI written telling this, or you type your symptoms, you get that is AI. What common man knows that. But yeah, there is IBM Watson, which is also an AI. The problem there is we change with time. The cancer changes with time. The knowledge changes with time. Uh, and patients are not very comfortable taking treatment from a smartphone. They would want someone to counsel them. They would want someone to help them through some symptoms, whether it's common with them. It's not the phone saying 4% is the risk of nausea and vomiting, 4% is the risk of vomiting. Don't, who will gonna tell you that? So if you speak with hundreds of patients nearby or friends and family who has gone through, that is where human touch makes a difference. I know they have their role in clinical research, they have their roles in surgeries, they have their roles in radiation, all of them. AI, they are not standalone. With human touch, we both can march forward in the treatment of cancer. We need their support, they need our support. Some places are too remote, we don't know what's the newest update and things like that. You can always ask AI to guide us with some rare cancers. We never may have seen them, and that is where AI can help us. So it is both together which can make a way forward rather than telling I'm superior or the AI is superior.
And coming to the family, how should a family support when a person, or per se a father, is diagnosed with the cancer? What's the first thing? Because emotionally everybody is hurt.
It's different in India compared to the Western population. In India, when someone is diagnosed of cancer, and Western, in the West, it's a patient who comes to know. The patient sits in front of the doctor, and the doctor tells him that such and such cancer is it. India, it's other way around. The whole family will know except the patient. Patient will be lying in the ward. The family members say, "Don't tell him." That's the first thing they say.
Yeah.
And the whole family, 50 people will come, sit in your chamber. We explain them. 5 days later you realize that only two people were actually supposed to be told, and that fellow would have, the whole family would have told everyone else about him, and he'll be like looking like what happened, why is so many people coming and things like that. The first visit, second, third visit, we realize who's actually their family member. The wife may be coming, or the husband may be the only coming, or the children may be the only coming. So we'll know actually who the family member is actually. So after the third visit, we'll know this fellow is taken care by this person, not the first visit. We try explaining, we'll tell, let all the reports come, then we'll explain. So the family members, what we say in the West is different, what here is different. Here, there the patient decides whom he has to tell, which family member he has to tell, whom he should not tell. Here the family member decide whether he has to be told, first thing, whether he has cancer. Second is what stage of cancer, whether we have to utter the word like chemotherapy, surgery, radiation, or just tell some laser treatment for radiation and chemotherapy, some IV fluids is going and some injections are going and things like that. And for surgery, we tell a tumor and we don't even say the word cancer. So there are a lot of barriers which we face. But over time, we will realize who is a caring member in the family who is taking care of. We need to explain them. And then after some time, when it is terminal, when the patient himself, many a times they tell, don't tell the patient, but after some time they will realize that the patient himself will realize, even after so many visits, I'm not improving, I'm actually getting worse, my symptoms are not improving, my pain is not improving, my bleeding is not improving, I'm actually becoming more thin, I'm not able to eat. That is when the family members have no answers to tell, why is he losing weight? That is when we come into picture. We'll definitely explain what is happening. The earlier it is told, the earlier the news is broken down, it's better for us. But yeah, it's finally depends on the decision of the family members, what they expect an oncologist to do. Some of them expect in early stage only to be told, some of them don't expect. So how to break the bad news, the family members decide. Once a biopsy is done, no one knows where the CT scan report is. Only one family member will have it, he'll hide it, he'll be spending and things like that. It's different scenario.
So, what advice would you give the patient once you meet them? Initially, when you go to meet and say surgical, or he has to come for the medical oncology, especially chemotherapy, because people are scared of the word chemotherapy. So, what's one advice would you
People are
give?
scared of the word called cancer and not chemotherapy or radiation. They are first scared of the word called cancer. That's the first word. So whenever they see us, they, if someone in their family would have been treated by me, they will know, oh, this guy is a cancer doctor. What is he doing here? That's the first thing they will say. So it's the word cancer which they're worried about, because they would have plan of their life in a different way. I lived some 8 years, 9 years, and then they see us and we're like, okay, this fellow means some cancer I have and somewhere it is. We always try to, uh, as a patient, they will ask what is the correct way, what is the correct stage, and things like that. As family members, they would have told, please don't explain in all in great detail. So we take a path middle in between, in great detail about what is it, what is the treatment needed. We may not explain the stage and how long he may survive if it's early, advanced stage. Or in early stages, we'll definitely give them, explain them what is it and what stage, and it's gonna be curable and things like that. For a child, it doesn't matter. Child will definitely not explain anything. They'll be running in the ward, taking a step, running around with the BP apparatus. It's a holiday for them of 1 month or 2 months. So it's a different scenario. How do we explain a patient of what cancer it is?
And any message to the young viewers who are actually watching our podcast? What message would you like to give them?
The word cancer is not what you see in movies. It's not the end where you sit in the bed and do nothing. The word cancer now at least has become more like a chronic disease. Detect it early. Look at symptoms, it changes in your body. Detect early, you'll definitely treat it like a chronic disease, some tablets or some target treatments and something like that, and it can be cured also with surgery, and it's more like a chronic disease, a lifestyle disease. To prevent it, be more aware of what it is, and like how you Google all other things in the world, how you use Instagram for all other things. If there's something abnormal in your body, ask your treating doctor or a family friend who has gone through it, or a family doctor. They will be able to guide you. And not all swellings in your body is cancer. Some of them are just hormonal changes and don't have to worry much. In the end, be aware of what changes are there occurring in your body, something which you need to be worried about or not to be worried about. And cancer is not a death sentence. Cancer means a chronic disease.
Thank you for being a part of this vital conversation, and I hope this has helped you create awareness among the people who have already been impacted. So let's stay strong and stay informed. Until next time, bye bye, take care.